everyone, my name is Caroline Hendrawan. Last week, I just finished my internship with Northwest Disability Services, which is a non-profit organization based in Hills area. So what they do is helping people with disability by turning their dreams into reality. It was a great experience. I did 140 hours of placement. I work in the office side as an administration assistant. I also did a little bit of lifestyle assistant thing as well. So this video is going to be about the reflection on those placements. Referred to the Australian College Health Services Management competencies. Hope you guys enjoy it and hope this will be helpful. Day number 1, today I just did an 3 hours induction section with Northwest Disability Service. So refer to that Australian College Health Services Management competencies. The first one is number 211, which is about understand the regulatory environment. So yeah, they just explains what's the purpose of this organization, what they do. This organization is a non-profit organization. It is under NDIS and bunch of services that they offer. So they have respite, they have cottage, they have group home, they have many things from kids to adults to one-to-one to group-based programs, activity. And then the second competency is about number 541. It's about balances corporate and social responsibility. So basically, the purpose of this organization is to turning dreams into reality, because there is a stigma and assumption in the community that people with disability, they can't do anything, even they have dreams or stuff that they want to do. They will not be able to make it because their cognitive or physical impairment, but it's actually wrong. Nothing is impossible. And the third competency will be number 543, which is demonstrate a commitment to ethical conduct. Basically, they told us about how you dress appropriately. You wear like something like shirt, you wear like clothes, shoes, like the proper one, like a comfortable clothes, like a formal casual clothes basically. And then if you have any concern about like what if you saw one staff did something ridiculous or inappropriate to the participants or something is not right, what you have to do, you have to talk to the supervisor. So the supervisor will taking care of the next step. Day number 2, today was the second day I do my internship in Northwest Disability Services. So I joined the program today. I didn't work in the office because a program called Ladies of Leisure as a lifestyle assistant just help. So refer to the Australian College Health Services Management. So based something called TA, which is task analysis. Basically, it says about each participant. So it's got the participant name, it's got their goals. They have like 4 main goals, and under that section, there were couple of 4 to 5 subsections within their goals. So basically, for example, there is a participant's name Franny. She needs to be more focused on her daily routine in hygiene, for example, washing their hands. And then there's a subsection like steps, like she has to ask the staffers to accompany her to wash their hands. She has to wash their hand in this step, turn on the tap, look at the mirror or something like. Under 514, which is demonstrate commitment to quality and safety. Understand and promote quality, safety of care in healthcare. Day number 3, I just finished my placement. I did 5.5 hours. So what I did was turning dreams into reality list, and basically I was doing data entry. which is it's gonna fall under the competencies number 363, which is uses health information. Yeah, so basically it's bunch of participants' name, and it's got bunch of their dreams, and some of them they have 5, 6 to 8 dreams. So yeah, and then refer to the competencies again. There was a section number 213 which understands how the health system works, the structure, funding, and organization the organization. So health works non-profit under NDIS, and then people in the office, they told me before the owner was different, so it wasn't under NDIS. Before NDIS, all the staff are being pushed to work only in therapeutic recreation base and nothing to do with the health information or the data handling, the paper, whatever it is. But since NDIS come, everything just changed. A lot of staff being pushed to do the paperwork, the HR thing. It's become more organized. Yeah, something like that. And the funding. So NDIS mostly fund the staff, of course. So the staff, they have a price guide. Day number 4, I did my 6 hours internship today from 9 to 3. Well, I did same, turning dreams into reality, which is program planning. And so what I did, which is different from yesterday, was some of the participants, they have similar dreams. So what we do, we pull all of those names together, those who have similar dreams. For example, person A wants to drive a car, person B wants to drive a taxi, person C wants to be an Uber driver. So 3 of them, they have similar dreams, which is something to do with driving a car. So what we do, we pull those names together, we make a list for those who want to do something to do with the car. So what we do, we can facilitate go-karting, something like that. So basically what I have to do, I have to make bookings, emails, and phone calls. But beforehand, I have to do research of like for the price, which one is cheaper, and then which company, and make the location wise as well, which one is closer, which one is further. Yeah, so it will fall under 412 section, which is listen and response appropriately, both verbally and inverbally. This will be fall under section 221, which is manages the health workforce, volume, supply, etc. So my supervisor, which is Janine, she told me it's better if they do it in a group, because it will reduce the cost instead of doing one-to-one. And then that the staff as well, the staff will be 1 to 3 ratio, which is 1 staff and 3 participants, or 1 to 2 ratios, something that kind of stuff. Because if it's one-on-one, of course the salary will be more expensive, will be higher. But if it's 1 to 3, which is if you do it in a group, only 1 staff and 3 participants, of course it's cheaper. Day number 5, today I did my 5 hours work placement. I did the same thing. I did data entry and managed the health information for a turning dreams into reality list. I did color coding, means that these dreams, it is being proceeded. If it's green color, it means it is still in progress. If it's yellow color, it means that dream has been achieved. So we can ask for another dream, you can say that. Yeah, so we work in a team, me, Janine, and Fiona, but because they have other stuff to do, so basically I was the one who help them doing this data. But if I have any question, and yes, I had a lot of questions because I'm pretty new into this field. So yeah, I asked for guidance and everything. So it will fall under 412 sections, which is works in a team effectively to do. Number 6, today I did my 5 hours of placement. I was doing the same thing, which is turning dreams into reality. I working on the data, and I also made a proposal on a new activity. It will fall on the 353 section of the competency, which is evaluates action against plan. So this is referred to the proposal that I made. I had to make a proposal of an activity, because some of the participants, they have similar dreams, and then I asked Janine, shall we make a new activity or a new program? And then she said, yeah, it is a good idea. It's better to make it as a new activity within a 1-day program, cooperate that with the existing program. So it's like a sub program. So it's program inside the program. Yeah, something like that. So yeah, I did that. I made a summary. Janine said, put every single details, how the program will run, how many stuff will you put there in the program, and then the time and the equipment that you need, so we can calculate the budget and everything. And then after I finish, I sent the proposal to Allison, which is someone who is higher than Janine. She is the one who giving an approval whether it is beneficial or not, if the participant joined the program, and so on. So yeah, and then I also had to send an email to the participants' parents and make sure they will agree if this kind of activity will be allocated into their program. And yeah, I need to waiting to get an approval for them. So it will fall under 411 section, which is maintains effective stakeholders relationship, both internal and external stakeholders. Day number 7, today I did a 5.5 hours of placement. Today I did the HR thing. So the 331 section of the competencies, which is plans for an appropriate workforce at the health of the organization level within available. Also 354 plans for business continuity. So what I did was I asked her what kind of software do you use, and then she said, yeah, I use a software called ShiftCare. Basically, it says the salary of the staff, the profile of the staff, and yeah, so and then she can see, oh, this staff today is in between the staff, the rostering as well. She said that the actual day-to-day program that runs daily, it is a fixed roster. So for example, this person every Wednesday will do the same program for every Wednesday, that kind of stuff. So it is fixed. It's got the ratio as well, like 1 to 3 or 1 to 2. It means 1 staff, 2 clients, 1 staff, 1 client, and so on. Also in plans for business continuity, she say, she has, so for example, in 1 day average around different locations. So Northwest has a bunch of locations like Baulkham Hills, Rouse Hills, Gem Hill, and everything. There is a section called floaters stuff. So in 1 day, she say it average around all of those campuses. There are 3 to 4 people call in sick in the morning. So that's why she has to put couple of tentative, like 3 to 4 tentatives, to fill up the gap if someone call in sick, to replace them and cover their shift. Day number 8, I was doing a quality insurance, but mostly just data entry. It was a PCP, which is one of the type of quality assurance. It is about patient-centered care data. It says about their behavioral plan from the psychologist, their data, their allergies, what they can do and what cannot do. Like they can take shower, they can eat, or they are not aware of strangers or something like that, and the level as well. So basically, it will fall under the 363 section of the competencies, which is uses health information. Also, so basically, I have to double check between the hard copy, which is the paper, the actual data, and the one in the software, whether it's the same or not. And I need to get an approval, like a sign, like a signature on each section that have been edited. And also I have to put the date, like the actual date, when did you edit this. Day number 9, I did a 5 hours of internship today. I was doing the quality assurance again. I was doing data entry. So it will fall under the 363 section of the competencies, manage health information, and I also work within a team. So today I was introduced to another supervisor named Ronnie. So Murray and Ronnie, both of them, they work together to deal with all of this quality assurance thing. So there are 3 types of quality assurance, which is called PCP, which is person-centered care, and then there is called TA, which is task analysis, and the third one, there's innovation meetings. I work in a team, so it will fall under the 412 section of the competency. Today is the 10th day, I guess, of my work placement in Northwest Disability Services. I did 5.5 hours of placement today. I was doing the same thing. I did same as the last one. So I did PCP, which is a patient-centered plan. So I was doing data entry again, cross-checking whether the paperwork actually matched with the one in the software. Basically, the different thing about today, I did phone calls, making bookings to the carers or the parents of the participants to have a half an hour or an hour meeting with my supervisor. So I made a call and just say that on behalf of my supervisor, I want to make a booking with you to discuss the PCP of these participants, what day will be matched for you, and so on. So it will fall under the 411 section, which is involving the internal and external stakeholders with the collaborative technique. So so basically my supervisor told me that they do this PCP booking and meetings. It's once a year. Since the NDIS come and take over the company, the organization, NDIS want this meeting being held for every once a year, or maybe even twice a year if it's possible. But at least minimum once a year. Also, the problem with making a booking, some of the carers or the parents of the participants, they are very busy and they only available in certain times, while my supervisor, she gave me only a quite limited amount of time as well, of her availability. So for example, she only available on Monday between 10 to 12 o'clock, and I have to fit in at least 2 to 3 people within those time. And some of them, they say they have work in the morning or something like that. So what we have to do, we have to adjust and like my supervisors have to sacrifice her time and say, okay, if the parents or the carer cannot do that, yeah, that's okay. They can do whenever they want. Like the hours whenever they available. So it will fall under the 5 to 4 section of the competency, which is patient or community is the central needs of the healthcare. Day number 11. Today I did 6 hours of placement. I work in a program as a lifestyle assistant. I wasn't work in the office because too many people were in the office and there was no space left for me. But that's okay. So aligning with the competencies, I had a chance to helping one of the staff during the program filling up the TA or quality assurance. It is a task analysis part of one of the type of quality assurance. Basically, because of the news recently that NDIS get fraud from a non-profit organization, they asked a lot of money from the NDIS, but they ended up didn't really give that back to the participants. So yeah, NDIS asked most of the organization, non-profit organization who work under them, to match the progress of the goal, which is the goal in the task analysis, with the progress that they have made so far, whether it's improving or not, and make a summary, so they can document that. And if the progress it's been good, it means the program works well. It means they will fund the program. But if the progress is not work effectively, it means whether the program is not effective or there's something that needs to be changed, something like that. So it will fall under the 212 section, which is how important the politics, socio and economic affecting the run of the organization. Today I did 6 hours of placement. So I was doing the program, which is lifestyle assistant, but I was also went to the office to just follow up a bit of the turning dreams into reality session. Basically, I just asked my supervisor what happened after I submit my activity proposal. Have I get any news from them, whether Allison already approved or not? And then what's the next step that should I do? So yeah, so it will fall under 211 session of the competencies, which is understand the regulatory environment. Yeah, it has been approved by Allison, which is someone higher than Janine. And then she say, so what I have to do, so I need to check the equipment, whether the equipment are available in order to facilitate the program or not. Day number 13, I did 6 hours of placement today. I was doing data entry for the task analysis again. Just match the paperwork and the one on the system, whether they are similar or not. If there is any changes, I need to get an approval, a sign, and then make the date out of it and make it in different color and something like that on the system. So it will fall under the 363 session, which of the competencies, which is users health information, how you manage that, and then 4-to-1 session, which is listens and responds appropriately,